This video about the use of chromium supplements for longevity extension. So I spent quite time to learn should I include chromium supplements to my protocol or not. This is a result of my research. I am changing the way how I present this data. So I remove the sources. I keep it for myself. I only left the conclusions. Let's go. Protein glycation and glycated proteins as so-called glycation end products in the extracellular matrix limit lifespan in mammals by reducing cellular health and function. Okay, this I was talking always about this. It's I believe it is main factor why we live shorter, because our extracellular matrix collagen gets glycated and we are losing elasticity. Our body gets stiff, all organs and skin included, and this is the result of all these problems in elderly. Okay, then let's go. High blood glucose levels cause glycation and accumulation or buildup of glycation end products, which affect diabetics more than healthy individuals. Calorie restriction can increase lifespan by lowering blood glucose levels and showing protein glycation. So you see that the mechanism is not only autophagy, like people say, but it is mostly, in my opinion, and other experts also say so, that calorie restriction is increasing blood glucose level, in average at least. Lowering blood glucose levels to slow down aging can be achieved by following a ketogenic-carnivore diet where fat is the main energy source. Most cells can use fat for energy, while only some cells like erythrocytes, cancer cells and cells infected by viruses need glucose. The brain works better on ketones derived from fat than on glucose. This is also important. Because official recommendations are like, oh, we need glucose for our brain. No, we don't. And high-carb diet actually may lead to degenerative diseases in elderly, like dementia and Alzheimer's. So stay away from these carbohydrates, in my opinion. Okay, some medications and supplements can slow down aging and extend health span and lifespan by affecting blood glucose levels and cellular metabolism. Metformin is a diabetes drug that has shown longevity benefits by increasing insulin sensitivity, reducing oxidative stress, and protecting vascular function. Consequently, metformin is considered as a potential candidate for targeting aging mechanism. However, recent clinical trials didn't show very big longevity or extension because people didn't change the diet. They used metformin, but but no changes in the diet was used. So metformin indeed can slow down aging by slowing down of the glycation process, but clinical trials were short. We accumulate glycated end products for long, clinical trials for long, and then clinical trials failed to show lifespan extension with metformin. Berberine is a compound that extends lifespan and health span in mice by activating AMPK, suppressing mTOR, and igniting autophagy. It is reducing glucose and lipids level in blood, because lipids level in blood are not from a consumption of fat. Lipids level are coming from your adipose tissue. This is if adipose tissue is overloaded by fat, then you are getting high level of glucose. So better to reduce the amount of the fat in your body and following diet like ketogenic diet, in my opinion. Berberine reduces glucose and free lipids in blood, as I said. It improves heart health and could aid in the treatment of non-alcoholic fatty liver disease. Again, because with lower levels of glucose in blood, we don't have all these problems. Berberine increases the lifespan of chemotherapy treated mice by 52%, and normally aged animals by 16.5% respectively. The naturally aged mice residual lifespan was increased by 80% from 85.5 days to 154 days. So, okay, again, it's in elderly people, it's absolutely necessary to stay from carbohydrates, to my opinion. And to use berberine or not, it is another question. So berberine can help, but again, for maybe ketogenic diet works better. Chromium as a trivalent ion, chromium III, has been suggested to regulate carbohydrate and lipid metabolism by enhancing insulin sensitivity and functioning as an antioxidant. The additional benefit of chromium is that it can work as antioxidant, but it is actually concentration of this chromium III in cells low, so it is not big deal. Chromium III supplementation acts similar to calorie restriction, preventing hyperglycemia, hyperinsulinemia, and protein glycation, and extending and then these supplements extending lifespan, at least in rodents. Initial research with chromium III picolinate supplementation in the mice showed a significant increase in median and maximal lifespan, along with lower blood glucose levels and reduced protein damage. And okay, well, that's data. So some Professor Evans reported that laboratory rats supplemented with chromium III picolinate lived to a median age of 45 months. Rats deficient in chromium typically survive for no longer than 24 months. In addition, rats with chromium III induced longevity. So these rats who are, which are getting supplements of chromium, they had 25 lower blood glucose levels and 60% less glycation-induced protein damage than control rats. Again, this is, we can relate life extension to reduced level of glucose and also less glycation protein damage. Since both the pineal gland and thymus are dependent on glucose and insulin level, chromium III may as well improve function of the endocrine system. Yeah. Probably, because we have accumulation of fat in the thymus, so it's probably related. So chromium, better function of immune system is related to reduced glucose and insulin levels. Chromium III may as well improve functioning of the endocrine system, because it is, again, endocrine system depends on glucose. If you follow the eating carbohydrate-rich diet. In terms of life extension, chromium III deficiency is most likely related to hyperglycemia, high level of glucose, and insulin resistivity. Okay, this is two factors which shorten our lifespan. Anything that will bring blood sugar levels down to a very low and stable level can slow the aging process. This is my opinion, this opinion of many experts. While some researchers believe that chromium III supplementation could be essential for individuals above a certain age, like 60 years, clinical trials with chromium III picolinate supplementation, 200 microgram, not million, microgram per day, and for 9 weeks did not show significant changes in body composition or strength during weightlifting training. Again, why? Because if we reduce level of glucose for only 2 months and a little bit, so what do you expect? It is this glucose and glycation of protein goes slowly during our life. So if we reduce for a while level of glucose in blood, it will not change much. the best what people can do, elderly, especially elderly people can do, it is to change to the strict carnivore diet, and then body composition will be improved and strength will be improved. This is for sure. I know it is from myself. I mean, I changed. I feel much better. I burn fat, and also body composition improved. Chromium III is poorly absorbed in humans, and consistent dose-dependent association between Chromium III and positive health outcomes have not been established. Only for, only for diabetics, they have some improvement in blood glucose level, of course, insulin resistivity, and also systolic blood pressure dropped a little bit, but not diastolic pressure. However, no adverse effects have been linked to excessive Chromium III intake, although the possibility of harmful effects from the large consumption cannot be completely ruled out. So acute oral toxicity threshold for Chromium III is almost about 2 gram. I mean, from 2 gram per kilo, it is huge. 2 gram per kilo, it's huge. So Chromium III is not very toxic, but Chromium VI is more toxic, and it has median fatal dosage of about 100 milligram per kilo of body weight. So this is, of course, we have to take care that if we are getting supplements Chromium III, it can be together with Chromium VI. So it has to be purified at least. Okay, the lack of effects of Chromium III in clinical trials on body mass index and liver function with daily doses of Chromium III in a range of 200 up to 200 up to 1000 microgram, not milligram, microgram, have not approached the lack of effects. It is probably because the mice and the oral rodents were getting much more of this chromium to generate beneficial effects, much more than 1 milligram per day, and actually we are talking about 10 milligram per day. So clinical trials, but there was no clinical trials with such high doses. So the clinical that if clinical trials with using more than 10 milligram Chromium III per day would be required before any definite conclusions regarding beneficial effects of these doses of Chromium III in humans can be recommended. Again, we don't know. There was no improvement. There was no improvement at low doses and relatively short supplementation, like 9 weeks. But it can be a long-term supplementation, and at higher doses of Chromium III probably it will help. But again, question is it will help to diabetes or diabetics or people, normal people. It's question. So chromium most probably contributes to a reduction of the blood glucose level, but again, the positive impact we will see in long term because glycation reactions are very slow. And second, it can be combined probably with supplements of berberine, and I would not take metformin, but berberine is okay, and probably, and most probably, the following ketogenic diet, I believe. This is the way. Okay, anyway, people with kidney disease or liver disease should be cautious about taking high amounts of chromium. It is not that I recommend to use this high doses of chromium, but again, our attention should be like, should we use chromium for long term? Because in developed countries, people use stainless steel in cooking, and we are getting a range of 30 microgram doses of chromium with food, just from stainless steel. But it is not recommended doses, it's just we are, in average, we are getting from food. And but should we use this chromium 3 in large amounts, it is not yet clear. So, but conclusion is such that to achieve radical lifetime extension, 4 additional regenerative steps are needed. Again, first, enhancing extracellular matrix elasticity. This is what I believe is the most important, and I work in this direction. I have some results, and but this is number 1. Okay. Next, clearing out accumulated waste products. It includes senescent cells. Senescent cells are actually waste. We have to remove it. Okay, and other stuff. It's a lot of other some oxalates, heavy metals, and lipofuscin, etc. So then next is what we have to do. It is regenerating the immune system and reducing adipose tissue. Okay, especially if we reduce accumulation of fat in our immune system, it is thymus and bone marrows, it will help for sure. And how to do it? Yeah, okay, that's following ketogenic diet probably. Or fasting. If you are fasting longer than 2 days on normal diet, or normal carbohydrates-rich diet, it can help. Or otherwise, what I do, I follow ketogenic diet or strict carnivore diet with some fat, and I normally, if I am okay, I also practice 1 meal a day. 1 meal a day, so I keep longer than 16 hours fasting, and then I believe it ignites autophagy, and I see positive improvements in my body. So, well, this is probably the way to go. And okay, then also these steps would restore optimal cellular health and functionality, prevent chronic inflammation, defend against pathogens, and promote fat burning. By addressing these factors, along with blood glucose level and protein glycation, a more significant extension of health and lifespan can be pursued. Okay, then this is what I say. So you see, again, more and more evidence that high level of glucose, especially if we follow diet rich with carbohydrates, is the source, probably main source of accumulation of this glycation end products, stiffening of the extracellular matrix, and all the problems are coming from here, like hyperpressure and chronic hypoxia in organs, etc., etc. So it is all related to blood glucose level. We have to reduce blood glucose level, but in long term. It is not the way to rejuvenate body, but to slow down aging. But to rejuvenate body, we have to do something with removing all these glycation end products from our body. It is possible. I believe it's possible, and I do it. But changes are going slow, unfortunately, because again, our immune system cannot manage quick with this problem. Okay, then thank you for taking time to watch the video. Please comment, subscribe, like, ask questions, and share information. And that's what I'm trying to do. I try for myself just recent improvements that I prepare instead of taking a lot of supplements, which I buy. I like to buy berberine separately, to buy some amino acids separately. I mix it all in some blend, and then it is much more convenient. First, because you can keep this blend in a refrigerator for months or whatever, and use everyday doses, take everyday doses of this blend, and also to consume not once or twice a day, but along the day with smaller doses. I believe it improves bioavailability, and I feel it. I feel much more energy, and I feel better. I sleep better, etc. let's see how it will work in long term, because I just started this practice not so long ago, but I see improvement, really improvement. So probably it is a way. But how to do it, again, because you cannot buy such blend from internet, for example. I do it for myself, and it's blend which includes many vitamins and amino acids, etc., and this bioenhancers, etc. So, but I did it, and probably I will. I can supply such a blend for some clients. I don't know, will it work or not by post, because I'm getting from China some supplements which are in powder form, are not expensive, blending these powders together, and then this kilos and kilos of these supplements I can keep in a refrigerator and use it slowly. So, okay, this is again my news that probably Chromium III can probably help, but in long term and probably in larger doses, or maybe doses more than 1 mil, or at least 1 milligram per day, probably, again I cannot say for sure, but 1 milligram per day, and then again maybe together with other supplements and together with a change following a strict carnivore diet. Yeah, this is my opinion. Okay, have a wonderful day. Ciao, ciao.